Right, there isn't a day that goes by that the topic is not COVID. Now, the hospital, I spoke to the chief medical officer yesterday. He really put this into perspective. As you briefly mentioned there, Jake, it was Washington State that saw the first confirmed case. It was Washington State that had the first death. So to see those first vaccines dropped off yesterday, it really brought everything full circle. But that's not to say we are out of the pandemic yet. We still have a ways to go. But later today, UW Medicine expects to vaccinate its first healthcare workers. That's going to be happening later this morning. A programming note for you at home: if you want to watch this happen, we're actually going to break into programming on King 5 so you can watch these first vaccinations from home. Now, the delivery yesterday included 3,900 doses. Many of those will go to doctors in the UW network. About 20% will be sent to other healthcare facilities. Chief Medical Officer Dr. Timothy Dellett told me the vaccine can be out of a freezer for about 6 hours and then in a refrigerator.
So you have some flexibility. So it's really, we're looking at a hub and spoke model. So we have a central receiving site with these deep freezers, and then we'll be able to develop a distribution plan to continue to vaccinate at all the other hospital campuses within our system.
Now, we talk about how we've been battling this virus for almost a year, but the timeline that this vaccine has been released is really critical, especially for Washington State. The IHME is predicting that hospitals in Washington State are going to reach their peak in the first few weeks of January. So right now, getting these doses, getting these healthcare workers vaccinated is crucial because it ensures that hospitals are going to be able to ensure that their staff is at full capacity when we hit those crucial, important weeks in those first few weeks of January. Live in Seattle, Callie Greenberg, King 5.